Hi, I'm Obi Imegwu. I'm a surgeon at Somerset Medical Center. One of my biggest interests is in doing minimally invasive surgery. I started around 2002 with, in addition to things like gallbladder surgeries, doing laparoscopic colon surgeries. And this was relatively new here at the time. And my interest in trying to provide patients with surgery that was painless yet comprehensive ultimately led me to look very seriously at robotic surgery. And so now I'm proud to call myself a robotic surgeon. For quite a long time, I've been able to find ways of doing fairly large operations laparoscopically, and even complicated gastric surgeries and colon surgeries have been able to be done minimally invasively. But there are still some areas in which the limitations of laparoscopic surgery, which is the conventional minimally invasive technique, lead us to sort of a glass ceiling, if you will. And what really led me to robotic surgery is that I found that now I could start to do things that would commonly be easy as an open operation or impossible as a laparoscopic procedure, basically, suddenly be able to get done with the small incisions that people prefer, and also which help them to get home faster and leave the hospital feeling better. When I think about how to treat a patient, I often make it as simple as what would I do if this was my mom or my wife or somebody I cared for dearly. And I find that approach simplifies things a lot. Not only is it helpful in choosing the right surgery to do, but it's also one of the philosophies that helps when difficult decisions, including things like end-of-life decisions, have to be made. Many doctors shy away from talking about the difficult things with patients, but if I break it down to treating a patient as I would a family member who I care for dearly, I think that it makes things a lot more simple. I think that what gives me the greatest sense of achievement is when, you know, somebody who's been anxious, who's been dreading surgery. Occasionally I have patients who come to me because, you know, they've put off doing something that they know has to be done, and finally, through word of mouth perhaps, they hear that perhaps I can offer them an answer. And when I'm able to give them what they were looking for and have them go through surgery, whether it's a simple or a more complicated surgery, and come back to my office with that sense of relief and gratitude for, you know, being able to fill that need. That's, I think, what gives me the greatest sense of satisfaction. One of the reasons that I chose Somerset Medical Center was that having been trained at several very large institutions, I've seen sort of the impersonal way that patients can be treated when they're in larger institutions. Some of the best institutions still leave the patient feeling as if they're a number, you know, that they're not being seen on an individual basis. And Somerset Medical Center is large enough to provide some of the great technologies that are typically seen only at teaching institutions, such as the Da Vinci robot, but at the same time provide that sort of smaller hospital setting that still allows that personal touch to be an important part of the care that's delivered.